Have you ever heard of sagging testicles? For men over 50, this condition can be extremely dangerous. Don't ignore it. Watch now. Do your testicles seem to hang lower than usual? When you look in the mirror, do you notice your scrotum sagging significantly, even when it's cool outside? Or worse, do you start to feel heaviness, discomfort, or notice that one testicle hangs noticeably lower than the other? If you're 50 or older, take a few minutes and pay attention, because this is not just about aging. It could be the first sign of a series of issues related to declining sexual health, low testosterone, or serious conditions like varicocele and inguinal hernia. According to a study published by the American Urological Association, AUA, over 27% of men over 50 with sagging testicles have undiagnosed reproductive or hormonal disorders. Why? Because most of them do one thing. They ignore it. They assume it's normal, a result of aging. A man thing they just have to accept. But the truth is, sagging testicles are not always harmless. So what actually causes this condition? There are 4 common causes, most of which can be prevented or treated. First, the aging process. After age 50, the dartos and cremaster muscles, 2 muscle groups responsible for suspending and adjusting the position of the testicles, start to lose elasticity. This leads to lower hanging testicles, especially when standing or during hot weather. Second, varicocele. When the veins in the scrotum become enlarged, blood flow to the testicles decreases, and the temperature in the area rises. This negatively affects testosterone production and sperm quality. You may feel a sense of heaviness, a dull ache, and visibly notice that your testicles are sagging more than usual. Third, high environmental temperature. Your body has a built-in mechanism to cool the testicles by relaxing the scrotal muscles, allowing them to hang lower in hot conditions. But if the sagging continues even in cool temperatures, it could be a sign of a regulatory dysfunction. And finally, inguinal hernia. When a portion of the intestine or fatty tissue protrudes into the inguinal canal and presses into the scrotum, it can push the testicles downward. Inguinal hernias not only cause discomfort and sagging, but if left untreated, can also lead to intestinal obstruction or tissue necrosis. To help you visualize this better, here's a real story. Bob Anderson, 62 years old, from Michigan. A retired engineer who enjoys fishing and gardening, Bob began noticing that one of his testicles was hanging significantly lower. At first, he thought, it's just old age. But after a few months, he started feeling heaviness, fatigue, reduced libido, and eventually a complete loss of interest in intimacy with his wife. After seeking medical advice, Bob was diagnosed with grade 3 varicocele. His testosterone had dropped more than 35% below the normal range. Bob said, "I wish I had gone to the doctor sooner. If I had known this wasn't just aging, things might have turned out differently." If you're watching this video, don't wait like Bob. We are 50 Plus Health Guardian, a dedicated health channel for men over 50. We bring you facts, science, and timely warnings so you won't have to live with regret later on. Click follow now and keep watching to learn the warning signs, potential complications, and the right ways to treat testicular sagging. Part 2. Warning signs and dangerous complications. Sagging testicles, if it's just a mild, symptom-free change, can be a normal physiological sign of aging in middle-aged men. But if you notice any of the following signs, don't wait another Bob day. Warning signs you must not ignore. One testicle hangs noticeably lower than the other. When you stand in front of a mirror and clearly see one testicle hanging much lower than the other, this may indicate a varicocele or even an undiagnosed inguinal hernia. A feeling of heaviness in the scrotum, especially after standing for long periods, walking a lot, or working all day. If your scrotum feels as if something heavy is pulling it down, It's a clear sign of poor blood circulation in the genital area. A dull ache or sudden sharp pain. Pain in the scrotum, even if occasional, should never be ignored. If the pain accompanies testicular sagging, it's a strong reason to seek medical attention. Scrotal swelling, redness, warmth, or bulging veins. These are signs of inflammation, infection, or excessive vein dilation. In some cases, if left untreated, they can develop into serious complications. Noticeable asymmetry between the two sides. If you feel or see that one testicle is larger, heavier, or consistently lower for several weeks, even if there's no pain, get it checked. Decreased libido, unexplained fatigue. This is an indirect but important sign. When testosterone drops, which is common in men with pathological testicular sagging, you'll experience low motivation, fatigue, and a loss of interest in things you once enjoyed. Dangerous complications if ignored. A sagging testicle may be an early warning sign of serious male reproductive disorders. If ignored, it could lead to the following complications. Reduced sperm quality. When the testicle has a varicocele, the temperature inside the scrotum rises, damaging sperm production. According to research from Harvard Urology, just a varicocele increase in testicular temperature can reduce sperm quality by up to 40%. Hormonal imbalances. The testicles are responsible for producing testosterone. If damaged or deprived of proper blood flow, testosterone levels will drop, leading to erectile dysfunction, muscle loss, osteoporosis, and even mood changes. Infertility in middle-aged men. Many believe that infertility doesn't matter at this stage of life, but that's not true. Infertility is often a sign of serious physiological damage, and it affects your entire endocrine system, immune function, and cardiovascular health. Impact on sexual life and marriage. Many men keep sagging testicles, reduced libido, or erectile issues a secret from their partners. But this silence can lead to long-term conflict, depression, and the breakdown of relationships. You see, what seems like a small sign can lead to big consequences. But the good news is, all of it is preventable if you understand what's happening inside your body. Next, we'll explore how doctors can accurately diagnose this condition in the clinic and, more importantly, the most effective treatments to help restore your sexual health after 50. Don't take your eyes off the screen, because what's coming next is exactly what you need to stay strong, confident, and in control as a middle-aged man. Part 3. Clinical Diagnosis and Comprehensive Treatment Solutions. So, what should you do if you're experiencing unusual testicular sagging? Don't try to self-diagnose. Don't Google it and draw your own conclusions. Instead, you need to visit a medical facility that specializes in urology or men's health for a proper clinical evaluation. 1. Clinical diagnosis. The current diagnostic process for testicular sagging is quick, simple, and completely painless. Step 1. A doctor will physically examine the scrotal area to assess the position, elasticity, asymmetry, and retraction capability of the testicles. They'll also check for signs of inguinal hernia, masses, or visibly enlarged veins. Don't worry. This only takes a few minutes, and urologists are professionally trained to perform this type of exam with care and discretion. Step 2. The doctor will likely order a Doppler ultrasound of the scrotal blood vessels. This is an extremely important tool for measuring blood flow to the testicles, helping to detect varicocele, assess its severity, and determine whether it may be affecting your reproductive or hormonal function. Step 3. If there's any suspicion of hormonal imbalance, the doctor will order blood tests to check your hormone levels, including testosterone, LH, luteinizing hormone, and FSH, follicle-stimulating hormone, to evaluate your overall male reproductive function. The results of these exams and tests will determine whether you're dealing with age-related physiological sagging or a pathological condition that requires intervention. 2. Comprehensive treatment solutions. Here's the good news. No matter what stage you're in, there are clear and effective solutions. A. Lifestyle changes. The first and most essential step, if your condition is mild and there's no serious damage, simply changing your daily habits can make a noticeable difference. Exercise regularly, especially with gentle activities like brisk walking, swimming, or yoga. These exercises increase blood flow to the pelvic area, improving testicular health. Avoid standing or sitting for long periods. If you work in an office, get up and walk around for 1-2 minutes every 30 minutes. Wear scrotal support underwear. Avoid underwear that is too loose or too tight. Both can negatively affect testicular positioning and temperature regulation. Avoid prolonged exposure to high temperatures. Do not soak in hot baths for more than 10-15 minutes and limit the use of saunas or heated car seats. B. Medical treatment. When prescribed by a doctor, if you have a mild varicocele that does not yet require surgery, or if blood flow to the testicles is reduced, your doctor may prescribe certain supportive medications, diosmin or horse chestnut extract. These compounds help strengthen vein walls, reduce venous congestion, and improve circulation in the scrotal area. Alpha-tocopherol. Vitamin E, or L-carnitine. These support sperm production and act as antioxidants for testicular tissue. If blood tests reveal testosterone deficiency, you may be prescribed hormone replacement therapy in the form of daily topical gels, patches, or testosterone injections on a regular schedule. Important note: hormone replacement therapy should only be done under strict medical supervision. Never use over-the-counter or internet-sold testosterone boosters or male enhancement products. They can lead to permanent endocrine disruption. C. Surgery. When there's a clear medical indication, if the varicocele has reached grade 2 or 3, or if there are signs of an inguinal hernia, surgery may be the fastest and most effective solution. Varicocelectomy, surgical ligation of the varicocele. This procedure reduces testicular temperature, helping to restore sperm quality and testosterone production. It's a minimally invasive, outpatient surgery with a short recovery time, typically 1 to 2 weeks. According to Cleveland Clinic, over 70% of patients experience significant improvement in sexual function within 3 to 6 months after surgery. Inguinal hernia repair. This surgery pushes the protruded intestine or fatty tissue back into the abdominal cavity, eliminating pressure on the testicles. If left untreated, an inguinal hernia can lead to intestinal necrosis, chronic pain, and sexual dysfunction. Whether you're in the early stages or already experiencing damage, early detection and the right treatment plan will help you regain and maintain your masculine vitality after 50. Don't wait until your testosterone drops too low. Don't wait until your sex life cools off or your relationship suffers. Taking action today is the key to strong health and unwavering confidence in the years ahead. Coming up next is our final section, where you'll receive practical, actionable advice on how to keep your testicles healthy and preserve your male vitality well into your later years. Part 4. Practical advice and inspiring conclusion. Now you know, testicular sagging isn't always harmless. It can be a silent warning sign of declining sexual health, of falling testosterone, weakened fertility, and even a drifting intimacy in your relationship. But instead of fearing it, you can take control. Here are simple, practical tips recommended by urologists and men's health experts, tailored for men over 50 who want to maintain strong sexual health and healthy testicles for the long run. 1. Self-check your testicles. Every month, once a month, Ideally, in the morning while showering or changing, spend a few minutes checking your scrotum. Is one testicle sagging abnormally lower than the other? Do you feel any heaviness, pain, swelling, or unusual lumps? Are there changes in size, firmness, or skin temperature? If you notice any changes lasting more than 2 weeks, see a doctor. This is the best way to detect potential problems before it's too late. 2. Get a men's health checkup at least once a year. Don't wait until symptoms appear to see a doctor. Just as women have regular breast and gynecological exams, men should have annual checkups for their testicles, testosterone levels, and reproductive health. A 30-minute appointment once a year could help you. Detect early-stage varicocele. Measure your testosterone levels. Get expert advice on diet, exercise, or treatment if needed. Think of this as an investment in your future strength and confidence. 3. Exercise. The right way. Physical activity is one of the most important factors in keeping testosterone stable. Prioritize exercises that improve pelvic circulation, such as brisk walking for 30 minutes daily, light cycling yoga or pelvic floor, stretching routines. Avoid overexertion or improper weightlifting. These can increase abdominal pressure and may lead to hernias or testicular strain. 4. Maintain a healthy weight and limit alcohol. Obesity, belly fat, and fatty liver are all linked to reduced testosterone levels. The more visceral fat you carry, the harder it is for your testicles to function properly. Alcohol also suppresses hormone production, increases estrogen levels, and dilates testicular veins, making sagging worse. Remember, just a 5 to 10% reduction in body weight can significantly boost your hormonal health. 5. Avoid habits that harm your testicles. Avoid placing laptops directly on your lap for extended periods. Skip long sauna sessions or prolonged hot baths. Do not smoke. Nicotine constricts blood vessels and damages testicular tissue. Avoid overly tight pants or underwear. Instead, prioritize a cool, breathable environment and proper scrotal support throughout the day. Final message for men over 50. You may have spent your life being the backbone of your family. You may have devoted yourself to your career, your spouse, your kids, or your aging parents. But now it's time to turn inward and take care of yourself. And that starts with not ignoring the small changes in your body. Testicular sagging, what may look like a minor issue, could be the doorway to a host of bigger health problems. You deserve to have a strong body, a sharp mind, and a fulfilling sex life, even after 50. If you found this video helpful, don't hesitate to share it with the men you care about, your father, husband, brother, or best friend. And make sure to hit that subscribe button for 50 Plus Health Guardian, where we deliver weekly, science-backed, real-world health insights to help you stay strong and thriving in your middle years. Thank you for watching, and we'll see you in the next video. Welcome to 50 Plus Health Guardian, where you don't just live longer, but live better.